Hey everybody, I'm Dr. Nykiel and this is our BBL series. We are going from pre-op to the operative day, post-op and recovery, everything in between so that you can learn more about this procedure. Now our own patients actually get a full booklet, but we decided to actually digitize this and make this into different series. So episode 1 is going to be what is a BBL? Stick around. So a BBL has actually changed names multiple times through the history. It was originally called a Brazilian butt lift in honor of Brazil that helped to really make this procedure popular. It's since been abbreviated into BBL, hence the mnemonic. What it is actually two procedures wrapped up into one. The first procedure is liposuction. And the most common question that we get asked is, where do you do the liposuction? And really the liposuction can be done anywhere on the body. Anywhere that there are pockets of fat, otherwise known as adipose tissue, we can go in, remove that, isolate that adipose tissue, and then inject it back into your buttocks. Now, for most people, and in our practice, the liposuction portion consists of what we call liposuction 360, which is essentially liposuction of the abdomen or tummy, the waist, also known as the flanks, and the back. We go about the level of the armpit all the way down to pubis, armpit down to your hip, and the armpit down to the top of your buttocks. That liposuction, in kind of that truncal definition, helps to create that hourglass shape that we're striving for when we do the liposuction and fat transfer. Now, after we have isolated the fat cells, we will then take the fat cells, wash them with antibiotics, and that just basically means we rinse the fat cells with antibiotics. Why? Because we're always trying to decrease the risks of infection and also clean the fat as much as we can. Once that's done, then we then inject the fat back into your buttocks. A common question that we get is, where can the fat be injected? Well, there's really only one place it can't be injected in the butt, and that is within the butt muscle. Because we know that when we inject fat into the butt muscle, it increases risk of complications for things called fat emboli, which are fat clots. So I'd say the majority of surgeons these days will not inject fat into the butt muscle. Outside of that, we can inject that fat anywhere in the butt. And what do I mean by that? Some people would like to have a bigger lower butt. Some people would like to have a bigger upper butt. Some people just want a rounder, curver, fuller butt. All of those are possible. You just need to tell us what your goals are, and we can then design where that fat gets injected based on your goals. Another common question we get is, when you say liposuction, what kind of liposuction do you use? This is very dependent upon the surgeon. Different surgeons use different types of liposuction. In our practice, we utilize a multi-step procedure of different types of liposuction. So we first go in with tumescent lipo, which is a very, very common liposuction that I think is pretty much everyone uses these days. But every once in a while in your reading, you'll come across the term tumescent lipo. And tumescent lipo basically means that we inject tumescent solution, which is consisted of a bunch of different medications, some that decrease pain and some that decrease bleeding, to help decrease your blood loss and pain. We utilize a certain type of cannula that helps to break that fat up. It's called a basket cannula as that tumescent gets injected. After that, we come in with a Vaser liposuction. So Vaser is actually a cannula that goes in and helps to break the fat cells up with ultrasonic sound waves. They basically create all these little tiny bubbles that help to break fat up. After that, we then come through with a micro-air powered liposuction cannula. And basically that means it just vibrates and moves rapidly. And that rapid vibration, that rapid movement helps to clean that fat out. Finally, in our practice, I come in with something called Renuvion, which is essentially a soft tissue tightener. It tightens the soft tissues by about 30% on average. Studies actually show it can go higher, but I always say plan for about 30%. And we utilize that because after we suck all those fat cells out, we'd like to see that soft tissue layer sort of collapse and contract along with the fat that we removed. All those procedures, that liposuction 360, those different types of liposuction that we use, then isolating that fat and then injecting that back into the buttocks. And sometimes you'll hear the term frame. And frame just means sort of that hip, the hip dips, or sort of the roundness in the shape in addition to the volume. Those procedures make up a BBL, also known as Brazilian butt lift, and it's also sometimes simply called a liposuction and fat transfer to the butt. Hopefully you learned something. Thanks for watching episode 1.